really important to know your patient. So I like to see patients, I like to ask their history. I think the most controversial topic is the pap smear. So when do we get a pap smear? And, our guidelines have changed over time. And this is the shocker. We start pap smears at age 21, whether the patient is sexually active or not. And that's now how we were trained, and that's now how I was brought up. So, age 21 is when you start having pap smears. And that does not mean that I don't want to see them before 21. That just means that's when we'll do the pap smear. You need to understand that a pelvic exam is the main exam, but the pap smear is only part of it. And that can be confusing for patients. So if I have a 16-year-old who's sexually active, I definitely want her to come in. We're going to do screening for sexually transmitted diseases. I'm going to check out her outer anatomy, her inner anatomy. We're going to talk about her periods. We're going to talk about all the things. We just won't do the pap. So do you understand what I mean when it gets confusing? Because patients want to tell you like, oh, well, I think I need a pap. Not yet. So for my teenagers, I like to always get, even if they're not sexually active, I would like to see them around 15, 16, mainly because they need to have a familiarity. They need to know that this is not taboo. Sometimes I may just talk to them the whole time and not examine them. I think it becomes a uncomfortable thing if the first time you're on your way to college and your mom says, "Hey, by the way, go see this doctor." We need to establish care and establish a relationship. So for my teeny boppers, just to recap, if they're not sexually active, I still would like to see them around 15, 16 years old. If they are sexually active, as soon as they start to have intercourse, they need to come see me. But the first pap smear, not until age 21.